Hey everyone, Dr. Hanisha here. Thank you so much for joining me on my podcast, Mahan Health with Dr. Hanisha. Mahan literally translates to great in Sanskrit, and it only makes sense to have the absolute best when it comes to your health. My goal is by you listening or watching this podcast, you're getting just a little bit closer to achieving Mahan or great health yourself. This podcast is all for you, so please make sure to comment what you'd like to learn more about so I can get a guest on the show who's an expert in that field, or I might even talk about it myself. I do see patients and clients all over the world virtually, so make sure to book your free 15-minute phone call today to see how you can start achieving Mahan or great health yourself. All right, let's talk about the episode for today. Today's episode, we are talking about something I'm extremely passionate about. We're talking about navigating health as a woman of color. So navigating the world of medicine, health, wellness, all of those things as a woman of color. And all people of color, men, women, or any other genders, do deal with their fair share of racism in medicine and in the world. But women in particular do tend to be a little bit more susceptible to poor health treatments in general, especially as women of color. This episode is coming out when we have recently had a huge research journal, the Journal of American Medical Association, that is where so much of our research comes from. They just stated that structural racism in medicine does not exist because there are no racist physicians. This is completely false. First of all, there are racist physicians. Second of all, there are even more physicians with implicit biases that we're just not aware of, and until we actively try to change our own biases, we won't be able to make a true difference in this world. So it's so important as physicians, all of us, to do our best to figure out what our implicit biases are and work towards changing those. So this episode is for my women of color, and I forgot, today is also International Women's Day, so it's even more appropriate. Happy International Women's Day to all of my amazing women out there, my patients, my friends, my mentors, my loved ones, the women that I aspire to be like, that inspire me every single day. Thank you so much for all that you do. All the mothers out there, my own mother, so many amazing women. So grateful for you all and wishing you all an extremely happy International Women's Day. But all right, let's talk a little bit more about the guests on the show that we have. Today, I'm interviewing Dr. Elaine Lewis. She is a naturopathic doctor passionate about improving the health and performance of her patients with naturopathic medicine. She strives to inspire patients to make the positive changes that they need in order to lead a healthier and happier life. Dr. Lewis is the co-founder and co-owner at One Elephant Integrative Health Team in Oakville, Ontario. At this clinic, she works alongside a diverse group of healthcare providers equally passionate about optimizing their patients' health using an integrative and team-based approach. In her clinical practice, Dr. Lewis helps patients with a variety of health concerns using safe and effective individualized treatments. Her goal is to guide patients toward their optimal state of health, whether mentally or physically. Her passion lies in women's health, helping all women feel heard and taken care of in order to gain control over their bodies and, by extension, their life. Dr. Lewis graduated from McMaster University with an honors of Bachelor of Science in Behavioral Neuroscience. She worked for 7 years in the emergency department at Credit Valley Hospital, and alongside exceptional physicians, nurses, nurse practitioners, and other healthcare professionals. This is actually where her passion for collaborative health practices were born. She completed her 4-year postgraduate naturopathic training at the Canadian College of Naturopathic Medicine, after which she graduated from a 2-year research residency focusing on developing her skills in teaching and research. So she's definitely an amazing human being. She's obviously extremely intelligent and super qualified, and she's honestly also just a beautiful soul, and we had a very great conversation on this extremely important topic. So I'm excited for you all to hear this and hopefully feel a little bit more empowered after this episode. But that's all I got. Make sure to rate and review the podcast and let us know what you thought of this episode, and reach out to Dr. Lewis or myself after the show. All right, enjoy. Hi, Dr. Lewis. How are you doing today?
I'm doing well. And yourself?
I am doing so well. I'm so glad to connect with you. It's so great to see you.
Thank you. You as well.
Yeah. Thank you so much for coming on the show. And, let's just get right into it. I always like to ask all my guests this question because I love hearing everyone's stories. So can you tell us a little bit about your journey into natural medicine?
Absolutely. It's definitely a long one. So I'm of Indian descent, and I would say my journey really started with the way that I was raised. Um, Not that I kind of quite realized at the time, but my grandmother and my mom were both nurses, so they kind of worked within the conventional medical sphere. But at home, it was really all about, eating certain foods, taking care of your skin, taking care of your body, using more natural preventative measures. And so that's, I would say, kind of my informal introduction to some of the tenets of natural medicine.
Mm-hmm.
But I really didn't think about it seriously as a career path by any means. I was really always med school bound. So I wanted to be, a medical doctor, and I kind of lined all of my ducks in a row from as early as I can remember. I think from the age of 5, I wanted to be in medicine. And it wasn't until towards the end of my university education that I even heard about naturopathic medicine. I kind of always assumed that this was just something that, our grandmothers did, but didn't really realize the formal education that went into and the regulation around naturopathic medicine as a potential option for me as a career. And even by that point, I was still very headstrong towards medicine. I had written my MCAT, which is, I don't know whether you have that, I think it's standardized across North America,
Mm-hmm.
right? So
Yes. Mm-hmm.
I had done that, and was really still moving forward towards conventional medicine. But I had a lot of different experiences within my last year, in my 4th year of my university degree, that just started to have light bulbs kind of go off and made me question whether conventional medicine was for me. So, I was working at the time in an emergency department as more of an administrative assistant. And I had been doing that to kind of put myself through school, through university. And I had always seen myself there. I'd always seen myself as kind of one of them, one of the medical docs eventually. And then all of a sudden I couldn't, kind of all of a sudden I began to really question whether this would be a path that would truly fulfill me.
Mm-hmm.
And a large part of that was realizing that, at least in an emergency setting, you're not really getting to what I really believed was the root cause. And my personality had always been such that I was a very curious person, and I so didn't love the idea of not getting to the root of the problem.
Mm-hmm.
And so that was kind of one of those turning points for me, but there were several that kind of happened all at the same time. And it got me to a point that I really couldn't see myself in that career path anymore. And simultaneously, my mom was starting to see a naturopathic doctor, which I was a huge skeptic of. And I went with her to an appointment to kind of point out the skepticism, being very science-minded at the time, all of that. And I thought, okay, like, what is this person doing? She was going to see her for arthritis, this ND in Toronto. And what I came to understand in that visit was that, I saw the evidence-informed aspect that I thought was missing. I also saw the science that I thought was missing. I saw the diagnostics that I didn't realize was part of naturopathic medicine. And then on top of that, I saw a philosophy that I really aligned with in terms of root cause medicine, in terms of prevention. And so it was kind of, a coming together of a few different experiences that really pointed me in the direction. And at the same time, I was applying for medicine. I was actually putting an application together for med school, and I couldn't press send. Like, I couldn't do it. And that was it. Once I kind of saw myself in this field and saw what my future could look like in terms of really feeling truly fulfilled in a career path that aligned all the way down. I couldn't unsee it, you know what I mean? And so
Right.
that's what it was for me. Yeah.
Yeah. Oh, that's amazing. I feel like we kind of have some similarities in our stories as well. Like, just the I actually did end up applying to medical schools, and I did DO schools because I wanted a more holistic approach, and so that was like what I was thinking would be a better option until I discovered naturopathic medicine, and then I was like, oh yeah, this is it. So yeah, I definitely feel you on that. And one of the things that one of my mentors always said was to always be an open-minded skeptic. And I love that you went in there with skepticism, but you didn't even realize it, but you had an open mind, right? Like you were open enough to it. And so like, I feel like that's something that I always try to think about pretty much all throughout my practice in general. Like every day I'm like, okay, like even if this seems absolutely crazy, let's be open-minded to it, but not fully just gullible and just believe anything, right?
I love that. I really love that saying. Yeah, that's
Yeah.
great.
Okay, so then what kind of drew your interest then from in naturopathic medicine to be more geared towards women's health?
So that too is a bit of a evolution, I would say. I initially was very much focused on, I would say, cardiovascular disease, more kind of metabolic syndrome, when I was going through my naturopathic education, but then also in my early years of practice. And so after kind of the formal 4-year postgraduate education, I elected to do a residency as well. And in that 2-year residency, I was studying cardiovascular issues. I was studying in researching cardiovascular issues. I was also kind of starting practice. And in that 2-year time, I began to realize that I wasn't fully enjoying that side of naturopathic medicine. And I began to see a lot of women just because, the nature of holistic health, I think it really draws a lot of women in. And so I was seeing them predominantly for their presenting complaint being cardiovascular issues, whether that was related to, their cholesterol or their diabetes or their hypertension. And a large cohort of them, I was realizing this was manifesting with hormonal changes. So when they were going through perimenopause or menopause and whatnot, and then just in the kind of naturopathic intake and just overall consultation process, we spend a lot of time just talking to our patients and understanding their barriers to health, understanding the problems that they face. And within that, I started to really recognize the void in women's health, the void that women were facing conventionally. And that really brought me to, wanting to serve that aspect of their health a little bit more. I was finding that women were really diminishing their own symptoms and kind of wanting to just power through, which I think is very much a systemic problem that we have as women. And of course they, this was like a secret they were sharing with me, that they were in fact not having it all together, and in fact were struggling, to kind of quote unquote balance their various interests and their various health goals. And so it began to become something that really inspired me to want to change and kind of shift the narrative, starting just with my own patients, and then recognizing that that was happening just even in my own circles of friends and, family members who at that time were kind of going through menopause. I was realizing that, this was a problem, and it was a problem that wasn't really being spoken about. And so that's what it was. It was a very natural shift, and it kind of got to a point where I was just really realizing I was focusing a lot on women's health, and I hadn't really intended to do that. But it just kind of came to be,
Yeah, it just happened. And yeah,
Yeah.
I think you're absolutely right with how there needs to be a systemic shift in the way we approach our health and our own needs, right? Our emotional, mental, spiritual, physical, all aspects of our health. Because yeah, I think you're absolutely right. Like I see so many women who like on the surface are like they act like everything is all together and like, you know, they're not suffering in pain, or that, you know, they're not dealing with all these issues. But then whenever they come into my office, it's like there's this whole slew of things that are actually happening underneath the surface. And I feel like, yeah, it's unfortunately really common, and we need to work on that. And I think slowly it's happening, but definitely more progress can be made. And then I guess so now today we want to talk a little bit more about how women's health may be a little bit different for women of color. So how do you feel like navigating women's health is different for women of color as opposed to our white counterparts?
Yeah, that's a great question. And I'm glad that, you know, to even have a conversation about it. I think the first thing with it is that, you know, we are diverse as a population, and there's a lot of different experiences that different people of color will have, right? And so I think we know that as women, already there's a little bit of an imbalance in medicine that just sex on its own plays. And then adding to that the layer of people of color, there certainly has been documented and in some ways very silent, and there's an undercurrent of ways in which race plays a factor in terms of all areas of life. But in this conversation, we're talking about medicine, right? And recently, with this huge race revolution that we are currently living through, I think there's been much more attention and a captive audience, I think, now with the kind of coronavirus as a bit of a backdrop. I think there's more of a captive audience of people who are recognizing and wanting to learn more and starting to kind of realize the problems that have existed for thousands of years, really. Right. And so with that, I think we're starting to see how deep rooted the problems really are. And, you know, this concept of systemic is certainly prevalent in medicine as it is everywhere else, right? And so I think when we're talking about the problems that we see in medicine, the first challenge is just really for us to acknowledge that there is one, or that there may be one, or that it's potentially deeper than we anticipate that it is. I think there's different layers to it. I think that there's a systemic aspect which stems back to the education system, and, you know, how we're being educated on health in general, how we're training physicians, who are the voices that are, you know, dictating education as it relates to medicine. You know, what are the textbooks that we're using? What are the acknowledgements of the history of medicine? That sort of thing. And then, you know, looking at the kind of practitioner level, realizing that already at that point bias exists, right? And so as women, as people of color, going to see a physician, recognizing that, you know, race is likely embedded within kind of the training of your physician, the system in which they work, and acknowledging that as practitioners, there likely has been internalized racism that has been brought through the system that we have been trained within, right? And so there's just so many layers to it. And what I'm just really encouraged by now is that we're able to have kind of open and frank conversations about the different ways in which this can translate into the patient experience, the practitioner knowledge base in education, and then on a much more foundational, deep-rooted place, the education system and the systems of medicine in general. You know, we work within a holistic framework. And even within that framework, you know, we're certainly not pointing fingers to conventional medicine versus holistic medicine. I think all medicine have these problems underlying. But within, our framework, we recognize that there has been kind of passed down generationally wisdom, and a lot of our traditional medicines have been appropriated in many ways, and we kind of started a little bit just chatting about, are we paying enough, uh, shining enough of spotlight on where this information has trickled down from? There's just so many layers to this issue, and yeah, it's a tough one.
Yeah, definitely. And I appreciate so much that you brought up from the beginning of the system, right? So from that education point, from our textbooks that we've used in medicine, right? Obviously in history books and things like that, there's so much that we've learned incorrectly or half truth, right? But if we're talking about just in medicine, there's so much of that, like you said, the lack of credit being given to these traditional cultures, these ancient medicines in general. I mean, things like there are so many pharmaceuticals that even come from ancient medicines or plant medicine, right? So it's not even just holistic or natural medicine that comes from that. It's a lot of our conventional medicine comes from other cultures in general, and or indigenous cultures in the States, or in the Americas in general. So so yeah, just like giving homage to those populations for what they've done, and for us in medicine, I think is really important. But then also addressing the history books of medicine, and in terms of like all of the types of terrible unethical studies that have been done on people of color, predominantly Black and Indigenous populations, and getting into that, like learning about that in school, I think in med school would be a huge game changer, right? In the way a practitioner then views the world. And so I think, starting from there is like, would be amazing if we can start to make those changes for sure. But then at least if you're already a practitioner, understanding the implicit biases that we already have based on our upbringing, based on whatever we were taught through, whether it's through textbooks or through the culture or the people we're around, just becoming more aware and mindful of that. So then we at least can lessen that bias, if not completely eradicate it eventually. I think that is so powerful, and I love everything that you just said about that. And it is so complicated, and I am very grateful that we can have these conversations without feeling afraid. Right? I think that, I'm not sure about for you in school how it was, but I know for me, like we had like multicultural clubs and stuff like that, where people of color, we would come together and have these conversations. But I realized, like, most white people really didn't know. Like they just had no idea, because they weren't a part of those conversations, which was important because we needed those safe spaces to be able to openly talk about the things that we dealt with, and then even separating those into even more groups to be like, okay, these are people who really understand what I've gone through, because we share these similar backgrounds. And but then now I love that now that we can finally get to a point where we can openly talk about this, and our white friends and colleagues can be a part of the conversation as well.
Yeah, absolutely. Yeah, I'm really glad you brought up kind of being able to have the conversation without fear or judgment, because that's so true. I think it's so important to have those safe spaces. I think it's also important to recognize that sometimes the conversations do have fear, right? And you are afraid of saying something wrong or offending. And I think what's more important is just to get it out anyway, right? To be imperfect anyway. And because it's only through that we can learn how to shift our language and reduce that internalized racism, right? That's there. And so, yeah, absolutely. I very much am encouraged, despite how really traumatizing and awful this situation has been over the last several months. But I think young people and all people seem to really be wanting to shift and wanting that information. And I'm really encouraged by young people who seem to be born with this activist gene, like they're really, it's great. It's great to see.
Yeah, I mean, and it is, yeah, it's phenomenal to see how we've seen shifts in the generations, right? Where even as like millennials and Gen Z just feel more confident in their own skin, right? Women of color or boys of color, whoever, people of color in general just feel more comfortable in their own skin to be able to advocate them for themselves and then continue their activism outside of themselves too. And that is huge. I think that is so important. And I really like that you brought up having the conversations or bringing things up, even if you are afraid that it could come off as offensive, right? Just doing it anyway. And it might be offensive, but unless you do it and you ask the questions, you won't know. And so going at it that way, or if you feel uncomfortable, there are so many resources now that you can go towards, so many books, so many articles, so many amazing people on social media that are talking about these things. And so you can get firsthand knowledge directly from these people.
Mm-hmm. Absolutely. Yeah.
Yeah. So kind of shifting a little bit outside of that, but kind of staying within the same realm, I want to talk a little bit about mindset. So mindset is super important, and that's a part of the biases that we see as well. So how do you feel like mindset in general can affect health outcomes? Like the mindset of, I guess, from the perspective of the practitioner. So if the practitioner has a certain mindset around things, how do you feel like that affects certain health outcomes?
Mm-hmm. That's a great question. I was initially thinking about it from a patient perspective. Honestly, the longer I practice, the more I recognize that the bulk of the transformation that we can achieve as practitioners with our patients and from the patient angle is related to our mindset. I really do believe that it needs to be leveraged, and we underestimate often the importance of bringing certain aspects of our emotional, mental, spiritual well-being to the table when it comes to our health. I think we overrepresent the tangible things like herbal medicine or supplementation, or even nutrition, exercise. Obviously, we consider them to be pillars and foundational when it comes to health. But I really believe that most people, patients and practitioners alike, really, in order to achieve long-standing and sustainable transformation, we need to ensure that what is happening between our two ears is as healthy and as optimized as possible. And I would say that for me personally, my own journey, just with respect to self-discovery, understanding myself, my own biases, and also my own strengths and weaknesses, so to speak, has really helped in my practice, in my way with patients. I think it has allowed me to be more thoughtful and intentional when it comes to working with patients. I would say early on in my practice, I probably allowed my ego to be involved a bit too much, just in the sense of really wanting to fix people, from a good intentions, but probably not the best impact. I think that I did that a little. I was in that space a little bit too much in my early practice, where I really just wanted to solve the problem as quickly as possible for patients, and I kind of overemphasized my role in their life. You know what I mean? Whereas now I let the patient speak a lot more. I'm able to kind of hear more what I think their struggles might be, and I very often will advise that patients I work in a very collaborative clinic, and we've intentionally put a group of practitioners together in order to really enforce the importance of the mind-body connection. And so I oftentimes will have my patients work with one of our counselors, one of our psychotherapists or social worker or psychologists, just to really start to dismantle certain limiting beliefs, certain blocks that they have with respect to their health. We walk around sometimes with a sense of our identity that's completely flawed and, based in half-truths or lies altogether, and oftentimes people don't even recognize that. It's not at their level of consciousness. They're just kind of walking around believing things about themselves, believing that this is the way it's going to be and fine is enough, you know what I mean? And it takes some convincing to sometimes move them towards recognizing what's possible with respect to their health. And so I truly believe that mindset is probably the biggest piece of the healing pie. We're talking about pie, even though we're naturopaths. I think it's huge. Practitioner for me personally, just in terms of the evolution of my practice style. And then I can't overemphasize it enough with respect to my patients,
Yeah, definitely. What do you feel like are some common setbacks for women in particular, or women in color in particular, in optimizing their health in terms of mindset? And
I'll speak to women of color first, only because it's something that I've recently really started to delve into with my patients, and that is coming from recognizing that what people are seeing right now is very skewed racially, right? And so I've recently just started, with everything that's been going on and at the forefront around race. I'm having conversations with my patients, as they're processing this information. And a lot of my patients of color are really starting to realize how much internalized racism they've been walking around with, and how much their years of oppression on even a micro level has affected the way that they see the world. So if we don't see examples of success in any industry, but also with respect to health, it's very challenging for our brains to recognize that that's possible for us, right? And so from a health standpoint, I've had a couple of patients recently who are realizing that they don't believe that this optimal health, which has been kind of purported in images, usually white images, they don't recognize that for themselves.
Yeah.
Which is, just imagine the weight that can hold, right? Are we holding ourselves back because we aren't seeing that this is possible?
Yeah.
So just so limiting beliefs related to that, right? I don't deserve, it's not for me, that have just been internalized through generations, right? And that's just related to health. Obviously, this happens in industry and in your career, and right? It's widespread. So that's one.
Yeah. And I'm just going to comment on that real quick. Sorry, before you go on. I just find that so fascinating because, I feel like personally, I understand the importance of representation and why that matters so much. And I understand how mindset can affect it. But I don't think I ever actually put that together in medicine, and how so many people of color don't see that that could be a possibility for them just because they don't see examples of that. And that was so powerful. I think that is so true. And I think that happens, I see it now. I'm going back, I'm like, oh my God, yeah, all of my patients of color, especially my women of color, have that sort of mindset. Oh man, just blowing my mind right now. Yeah.
Wild when you think about the layers, right? We don't have enough time to talk about it. No. But it's wild, and this is why it's just so important to have the conversations and that it's out there. And then, for women as well, because we're talking here about women of color who are experiencing 2 layers of oppression, at least, right? Like race and sex.
Mm-hmm.
And then we're talking about women in general who are experiencing at least the layer of oppression that is they're women, right? And, limiting beliefs related to being able to do it all, right? Weight is huge.
Mm-hmm.
Weight is really huge. Like the question of what are we holding on to kind of thing when it comes to weight. And I often find that when we're able to tap into mindset and we're able to let go of certain, we'll use the term limiting beliefs again, but things that we're holding on to that may not actually be true. And where is that being held in our bodies from an energetic standpoint? And so I see that a lot with women with respect to weight, right? Like making poor choices in the name of something very like a superficial emotion, like, oh, I'm just bored, or, oh, I'm just, I just wanted that cupcake, when really we're trying to mask feelings that are deeper that we aren't getting to unless we're asking the right questions and we're in a safe space and we're able to explore that. And so anyway, yeah, there's a there.
And honestly, I just actually remembered too, along with that, with any sort of trauma, you're more likely to end up going, I mean, obviously trauma is a huge stressor, and any sort of trauma that you've experienced. So especially with people who have intergenerational trauma because of their race, or women, in general, but having these traumas can increase your risk of like any sort of eating disorder. So that's including like binge eating or anorexia or bulimia or things like that, or even going towards other substances like alcohol or marijuana, and using them as coping mechanisms. And that increases your risk of falling into that sort of pattern. And that's because of the trauma. And I think, I mean, again, there's so many layers to all of this, and we can keep going forever because there's just so much that we could talk about in terms of this. But I think oftentimes then even when that happens, then there's this negative association with that then, and those people of color, or the people of color who are engaged in those activities, then get even more stereotyped, and there's more prejudice against them because of those sorts of things. And I feel like that we need to, again, going back to the root cause medicine, getting to the root cause, like, let's talk about the trauma that these people have endured. Let's talk about how we can help them process that trauma and therefore eventually optimize their health. Because they can, everyone definitely has the ability to.
Exactly. Yeah.
Okay, awesome. Okay, so I love this conversation so much, and like we said, we could literally sit here for hours and talk about this, but we don't have that much time. So was there anything else that, before we move on to the more rapid fire questions, was there anything else that you would like to add? Any other, or any resources that you would recommend for our listeners?
There's millions, as I'm sure people are very much bombarded by on social media right now. So I think social media has almost everything. I think in terms of just maybe some resources that related to our conversation, there's for people who are really interested in mindset, there's actually a book that's been around for a long time about mindset called Mindset by Carol Dweck. It's incredible, just as a bit of an initial teaser to understanding your own mindset. She talks about kind of a fixed versus growth mindset. There's so many books right now if you're wanting to understand the impact of race, or wanting to determine, now that you understand the impact of race and race issues, how to start to untangle them. And I honestly think that you can type race in at this point to Audible or Amazon or Google and find all of those great resources. I would encourage for Canadian audience to also look specifically for Canadian authors, because the issues in Canada have not been talked about as much, but they're still in Canada, and we need to talk about them for both the Black experience and the Indigenous experience. There's tons of great Canadian authors that I would suggest that that folks go out and try to find. But they're out there. There's lots.
Yeah, definitely. I appreciate that. And one of the things I actually just thought about was, do you know Humble the Poet?
Yes.
Yeah, he's from Toronto.
Yep.
So I was like, he's from your hood. But
Yeah.
he's amazing. One of the things that he said one time that I feel like I always think about and that really inspires me, and I hope that can inspire all people of color in general, is that he said that representation is important. And unfortunately, we may not always have that representation. So it's up to us to go out and become that representation.
I love that.
Right. And I love that too. And that's like what I think about if I'm not represented in a certain group, like, okay, I'm going to be that representation so that another young girl of color will see me up there and be like, oh, I can be like her. Right. That's kind of the way I try to see it. And so I think that always helps me be like, okay, even if no one else here looks like me, I can still do this.
Absolutely. I love that.
Yeah. Okay. So let's get into the rapid fire questions. So you do not have to answer them rapidly. It's more of just like, it's not as long as the first part of the interview. So my first question for you is, what does Mahan or great health mean to you?
This is a great question. I think that what it means is being in full alignment with yourself, like your true self, and making choices that are in alignment with good health and self-love, whether that's related to moving your body, whether that's related to the foods that you eat, whether that's related to the thoughts that you think or the behaviors that you kind of, work with. I really believe that it's moving freely through your life in whatever that means for you. I think that's the simplest way that I would put it.
Yeah, I love that. Okay, so the next two questions, they could be similar, they could be different, it's completely on you, are what was the most difficult health change for you to make, and what is something that you are currently still working on?
I think it is the same for me, and it goes back to mindset. I think it was only more recently, throughout my life, I've just kind of gone through the motions in many ways. You're kind of going through school and then you kind of hitting a new accomplishment, a new milestone. And I realized that I was very milestone focused. I was very accomplishment focused when it comes to my own happiness. And over the last few years, after kind of being in practice for about 8 years now, I would say, and I just recently actually just had a milestone. I just opened a new clinic last year, and I've kind of always been focused on what the next thing is. And I think recently my focus has been more on just sinking into what are the daily practices that, I really resonate with, that make me feel happy, and what are the mindset shifts that I need to have in order to redefine who I am, my identity, my purpose, these sorts of things. Mm-hmm. And so it's a work in progress. You're never finished when it comes to that. And so I would say it's both. It's been difficult, but also really rewarding, and definitely something I still work on.
Yeah, definitely. And I mean, I talk about mindset all the time. I feel like it's one of the most important things that we can really work on, because as soon as we work on our mindset and start to get that in line, we can really work with everything else, And so I talk about it a lot, but I also think it's super important to just celebrate the daily wins, just celebrate yourself every day and for all that you do in the day, and there are times I mean, I know I've done a yoga practice where they're like, oh, congratulate yourself for being here. And I'll be like, yeah, I did it, I'm like, I came here, I took the yoga class, like, and so I will actually like get into it. And so I try to translate that to so much of my life and be like, oh, like I cooked this dinner, like this is so good. And, just like getting excited about all the little things. And instead of waiting for these bigger, these bigger moments, just celebrating all the little moments all the time, even things as simple as I tell people this all the time. I like congratulate myself for remembering my keys, because I used to always forget them, and I'd be like, oh, good job, you remembered, Hanisha.
No, that's great. It's so important. And like, we know the importance of a gratitude practice on overall health and well-being, right? It's like, it's definitely not talked about enough, but the simple things, as in our medicine, is really what helps people over the long term, more than the fancy fluff,
Yeah, exactly. It's the little things, and it really is just doing the little things as often as possible will help just optimize our health in general and feel good. Yeah. Okay, so my last question is, if you could have a commercial about anything, like a PSA on health, what would it be about and why?
Oh my goodness. This is such a great question. And I really don't know. To stay on track with what we've talked about thus far, I would say, ask me the question again.
If you could have a commercial. So the reason why I even asked this question is because, I actually don't know in Canada, are pharmaceutical commercials allowed in Canada?
Actually, no, they're not. I don't think they are, but I watch a lot of US TV. So
okay.
I'm wondering whether I'm hearing.
Okay, I'm not sure. But yeah, so I know, there's so many pharmaceutical commercials, so many junk food commercials, all of these things that, obviously are doing the opposite of promoting health. And so the reason why I asked this question is because by all of the doctors, all of the amazing healers out there, if they could get their message out to the mass population, get it out to the whole world, like, and help everyone achieve Mahan or great health that way, like what would that look like, right? And so that's kind of why I asked that. So I'm like, all right, so what would your commercial or message be for the whole world to hear?
I would say that it's really the simple things that matter most. So, addressing your thoughts, addressing your nutrition and making healthy choices that feel good for you, moving your body, sleeping, and being around people that you love. That means the most when it comes to your overall health. So start there, and you're going to be farther ahead than most people.
Yeah, I love that. Just focus on the little things. Focus on the little things, and don't worry about the bigger stuff. I love that. Awesome. Well, thank you. Thank you so much for sharing. All right. My last question for you is, where can people find you?
So I am mostly on Instagram when it comes to kind of my public facing media. I would say mostly Instagram, and that's at Dr. Elaine Lewis, ND. And find me there. And that's usually where I post what else I'm up to.
Awesome. We will have all of that in the show notes, and also those resources that you talked about. We'll also get that in the show notes as well. Awesome. Well, thank you so much, Dr. Lewis, for coming on the show. This was super fun.
Thank you so much for having me.
Of course.
I hope you all enjoyed that episode, and if you are a woman of color, I hope you feel a little bit more empowered to stand up for yourself in healthcare, because it is absolutely essential, and you deserve to have the absolute best care. I don't care what anybody else says. So I hope this was helpful. I will have Dr. Lewis's information in the show notes below, so make sure to check that out. But that's all I got for you all today. Wishing you all Mahan health and sending you all so much love and power on this Women's Day, and I will see you next time.